The following is an exclusive presentation of Cablevision local programming, TV that's close to home.
CSEA recently negotiated a deal with Nassau County that would save up to 500 jobs for its members. Find out how they did it when we sit down with CSEA Local 830 President Jerry Laricchinta next on Cablevision's Meet the Leaders. Hello, I'm Pat Halpin, and welcome to Cablevision's Meet the Leaders, a program designed to inform and update you about your community and issues right here on Long Island. With us today is CSEA Local 830 President Jerry Laricchinta. How are you, Jerry? I know I'm pronouncing your name wrong. Let's get this straight.
Laricchinta.
Laricchinta.
You did pretty good, Pat.
I'm getting better. By the third time, I'll get it
name.
right. Jerry, as you know, these are really tough economic times, and every level of government all over the country is facing tough decisions, and it affects public employees.
Very much.
One of the rationales for the president's economic stimulus plan in terms of providing monies to states and cities and localities was that they estimated that 2 million public employees could be laid off if the federal government didn't do that. But Nassau County has an interesting opportunity, and that's the Lighthouse Project. When I say opportunity, in a sense that they can expand the tax base and create a lot of revenue. Now, I know you're not in the building trades. You represent public employees. But as a taxpayer, as somebody that represents people in municipal government, county government, what do you think of the Lighthouse Project, the redevelopment of the Nassau Coliseum area?
Well, in general, yeah, I think the idea is fantastic. It's a way of generating, like you said, revenue, sales tax, jobs, employment's very important for our brothers and sisters in the building trades. And we like the whole, we're in favor of the concept of it. My biggest problem with the entire project is never once did either of the two major developers, Rexon or Mr. Wang, speak about public employees. Where do they fit into this? This is public land being used to build private enterprise. And I think it's great, it's fantastic, but somewhere, who's going to maintain the parks? Who's going to maintain the public security there? Where does the public employee, where's the attachment to the public and to the taxpayer? I think that's the only thing that I would like to see change, but otherwise I think it's fantastic.
But you think that this is a project that's long overdue. I mean, you go to work every day in that area. You've got to feel like a lot of other people say. We've got the Nassau Coliseum out there in the middle of this sea of asphalt, and there just has to be a better way to do that, to really make that a place where people not only want to live and go to work and buy things, but also just come and enjoy when they have some free time.
Definitely, I mean, it's probably the most prime real estate in all of Nassau County. I go back and I remember it was referred to as Santini's. I don't know if you remember that.
That's before my time.
Or Mitchell Field, of course, was the other word. But the bottom line is absolutely, I think that area, if it's redeveloped, as long as they can handle the traffic and all the infrastructure problems they're going to be dealing with, I think it's going to be fantastic for our economy, and we do support it in concept.
Jerry, as you think about this economy and you think about how projects like the Lighthouse Project fit into it, Tom Swazi, the county executive, has said that one of the big challenges in Nassau County, and I'm sure you've had this conversation with them as you've negotiated, is that the tax base isn't growing. Basically, Nassau County's built out. We've got an aging population, which puts more demands on services. We're going to talk about healthcare and other things. But you've got to, but as you think about what the future of Nassau County is and the need for government services, there aren't too many opportunities like the Lighthouse Project that can generate tax dollars to the local school district. We have CSEA members, to the town, CSEA members, and to the county as well. There they get property tax and sales tax revenues.
Yeah, I mean, you're right. The tax base has shrunk. The ability for the economy to grow is just not there. This might be the last vestige or place where we can actually see an expansion of that. So I think we go for it, without a doubt. I think we keep an eye on it. And of course, you have private developers dealing with public land. So I think there has to be a watchdog and a whole group of people and activists keeping an eye on it. But I think we will, and I think it'll be a big positive plus for our economy here in Nassau County.
Okay, so the CSEA supports the Lighthouse. Let's get back to the things that you've been directly involved with. You went through some very, very tough negotiations with the county. over the course of the last year or so. You had to negotiate a new multi-year
2 years.
budget. And then new multi-year contract for your employees because your old one had expired. You did that successfully. But then you got hit by the tidal wave of this deep national recession. People on Wall Street being laid off left and right. The real estate market essentially collapsed. Sales tax revenues are down at least 10% over the prior year. Property tax collections have slowed. And the county executive comes to you and says, Jerry, we've got nothing but bad choices. We'll lay off hundreds of people, or we got to figure out a way to tighten our belts together. That's a tough thing for a labor leader to hear, especially after you've negotiated a pretty good contract for your members, all things considered.
You know, it was unbelievable, really. It was like watching a horror movie in slow motion. Because as the negotiations were progressing, excuse me, through the summer and into the fall, then we saw Lehman Brothers go down and Bear Stearns, and things just started collapsing. And I'm still in negotiations. And I'm like, we got to get this done very quickly because, listen, I don't know there's going to come a point where everyone's going to get cold feet and drop out. So, you know, absolutely, it was a nightmare going through it. It was 2 years of negotiations. The last 7 months were unbelievably intense. And we were successful in getting it. December 11th, we signed the agreement. January 4th, he announced layoffs. I didn't even get a chance to tell my members about the contract yet. So I was a little angry about that.
Of course.
You know, I'm like, hey, listen, guys, at least give me a couple of weeks to, you know, we did our job. We were both bargained in good faith. We understood, listen, the economy, we all care about the taxpayers because we are the taxpayers.
Exactly.
My members are the residents and taxpayers in Nassau County. They don't want to see anything happen to this county. But they also work for the county, and this was their livelihoods we're talking about. And we came so close to just having both sides walk away. You know, they say, what do they say, Pat? A good contract is when both sides walk away a little angry and a little happy. And we both did that. It wasn't I didn't get everything I wanted for my members, and Tom Suozzi certainly didn't get everything he wanted for the taxpayers. But we both completed the job in good faith. But it wasn't long after that when the doom and gloom started hitting.
Well, let's talk about the doom and gloom because we're still working through that. Tell us, after you put this contract to bed and your members approved it, the county executive comes to you and says, we've got to reopen this contract and make some modifications. Now, that is not something that a labor leader does, period. I mean, the automobile unions might do it, the auto workers might do it, and the airlines might do it because they're facing bankruptcy, and then the contract goes out the window anyway. Right. But that said, that doesn't happen here. But you came up with some very creative ways to get the savings that the county needed. Talk about those things.
Well, you know, I think it was February 3rd when Tom Suozzi addressed Nassau County in the legislature, and he said it's as bad as it can get. He was very open about that, and I told him that's going to be important to how we react.
Because he's got to communicate that not just to the county legislature and the residents, but to his employees.
Absolutely, he's got to be open about it. And we told him, if you're not open about it, and you don't come out and tell the world what you're telling me, we're not going to be that interested in sitting down with you. And he did. To his credit, he did. He was as honest as he could be. And then our job was to find out. He had 3 buckets. 50 million was labor. So all the unions had to get together and decide, do we want to do something here, or do we want to hold firm and take the union stance? And what we did was, I thought, collectively, all the unions did the right thing, and they helped out the county get past this crisis without permanently harming their members, and that was the goal.
So let's talk about the things that you were able to do with the county. One was that the county said we need to have an early retirement. We have people who've been here a long time. They are at the top of the salary ladder, and we got to figure out a way to encourage those folks to retire.
Well, that was in lieu.
And they sent specific targets. That was in lieu of layoffs.
In lieu of layoffs, we said, listen, wouldn't it be better for both sides if instead of laying off 550 members, we were able to get 300 or 400 on their own terms to leave? And both sides agreed. And we had, like you said, creative is the word. We worked out an agreement where each member was paid a certain amount of money for every year's service to entice them. And we wound up with 370 people.
And what's good about that is those are recurring savings. Those
Absolutely.
are not one-shot savings. When somebody leaves, if it's an absolutely essential job, it'll be replaced by a lower-paid employee. But otherwise, they'll keep it they'll keep it vacant,
Right.
I presume, and have that savings going into the future.
And we also, I mean, we agreed to a lag payroll.
What
which
is that
gonna-
all about, a lag payroll?
That's going to start in the middle of July, right? In a month from now. And what that does effectively is each payday you get paid 1 day later than you would the previous pay period. And by the end of the year, after 10 pay periods, you effectively have lent the county 1 paycheck.
Which is 2 weeks' pay.
2 weeks' pay. And then when you retire, you get it at that rate of pay you're making when you retire.
But still, that people need that money in order to pay their bills. I mean, I don't know too many people who are not living from paycheck to paycheck these days, or trying to pay down expensive credit cards and other things.
We
that
already
they've
did this in
accumulated.
'99, and it was, I remember it. I wasn't making a lot of money back then. And although it was painful, we were able to get by it, and we saved, I think at that time, Tom Galata was the county executive. I think he was looking for like 700 layoffs.
And how much money will the lag payroll save the county?
$13 million.
$13 million.
Right.
So every 2 weeks, the county has to save, well, no, every 2 weeks, the county pays about $13 million in salaries to your members.
Right.
And you'll get that back.
But we were able to hold the contract in place. And that's
Yes.
what the important part was. Without opening the contract, and we just got done negotiating for 2 years, I didn't want to renegotiate the contract. So we kept the contract closed, and we said we'll agree to a few items. One of them was a lag, and we delayed 2 wage increases for 2010 and 11. That saved the county $22 million, and we did our share.
So let's talk about long term. What we're talking about now are measures that you've taken that will enable the county to close its budget gap for this year. And everybody hopes that the economy is leveling off. It's going to start to pick up. What are the experts that work for the CSEA, you're a statewide unit, what are they advising you and other labor leaders about the state of the economy here in New York?
Well, I mean, we all know everything is really based on a few key issues. One is the sales tax. When sales tax comes in at -1 or 2, I mean, I think for every point negative, it's $10 million.
It's a lot of money.
It's huge. So, I mean, if it comes in at -6, which I think they're predicting for the next period, that's a loss of $60 million. You can't make that money up. So we're just holding tight. We want to make sure our members are out there. They do their job. They make the county whole as best as they can, and just pray that this crisis is over. I hate to see people losing their jobs. Look at foreclosures today. Unemployment is up. It's a disaster out there. I thank God every day for my job. I'll tell you right now.
All right, we're going to take a short break. When we come back, I want to talk to you about the Nassau County Medical Center. Your employees are working there as well. That hospital continues to struggle with budget issues. Some of them are beyond their control, but we're going to talk about your thoughts on that. So when we come
Absolutely.
back, we're also going to return with Dr. Aubrey Lewis, the founder of the Coalition for Community Wellbeing. So stay with us. We'll have more Meet the Leaders as soon as we return.
Discover why CME, the Children's Museum of the East End in Bridgehampton, attracts over 40,000 visitors year-round. CME offers children boundless creative opportunities for learning and fun. Ride a fire truck, climb a geodome, take a literacy class, be a musician, or learn to cook. Visit cmee.org.
Sure, my neighbors Gene and Louise, they may be superheroes with superpowers, but that doesn't make them so super at saving energy and money. I may not be able to harness the power of the elements, but I save significant cash and help the environment with appliances, electronics, and windows featuring the Energy Star label. Discover your own energy-saving superpowers with Energy Star. Go to getenergysmart.org.
Mom, Dad's making fondue again.
The EAC Long Island Parenting Institute enhances outcomes for children by helping parents learn and practice effective parenting skills. Using research-proven curricula and approaches, the Institute teaches, supports, and empowers families from all backgrounds and cultures. For more information, call or visit us at eacinc.org.
Welcome back to Cablevision's Meet the Leaders. In our studio today is CSEA Local 830 President Jerry Laricchinta and Dr. Aubrey Lewis, founder of the Coalition for Community Wellbeing. I want to thank both of you for Dr. Lewis for joining us in this conversation,
Thank you so much,
and of course Jerry for being here. Jerry, let's talk about the county's healthcare system, because I think it really sets up what we want to talk about in terms of community healthcare. Nassau County has a healthcare system where you have a hospital, unlike Suffolk County. Suffolk doesn't have a county hospital like Nassau County or Westchester County. And out of that, you have satellite healthcare clinics around the county that provide care to people who are either underinsured or have no insurance at all. The health care at Nassau County Medical Center and at the health clinics is as good as you can get anywhere, and there's no question about that. But it continues to struggle financially. From your perspective, what are some of the things that are happening there, and how can we bridge the gap between the deficits that it's running and making healthcare affordable?
Well, Pat, I think in 1997, I forget the exact year, when former county executive Tom Galata sold the hospital in a one-shot deal for $87 million and made it into a public benefit corporation. That was the beginning of the end for this.
Why? Was that a bad deal?
I mean, it was a dumb deal. I mean, you know.
Why was, okay, maybe you won't call it a bad deal. Why was it a dumb deal?
Because he needed the money, a one-shot deal that he probably spent the next day, and now we were out of this county facility, and instead now we have this public benefit corporation with a bottom line, and they're trying to make a profit there, and it's not going to happen.
Now, if he had used that money to reinvest in the hospital and do the kinds of things necessary as opposed to balancing the county's books, you know, it might make some sense to have a separate operating corporation. But you're saying he just used that to plug a hole in the county budget.
Well, the mission of the hospital is to serve everybody.
Right.
And we're proud of that. That's why we're here. But we don't turn anybody away. But knowing that, how can it be a corporation? If you owned a deli and every third person online had no money, and you took them anyway and served them anyway, would you be able to pay your bills at the end of the month?
Not for long.
Well, that's what they're doing there. And, you know, the problem is we ask that the county take it back. But, of course, all the politicians and government officials turn their head and they put their hand up and they say, that's not going to happen.
Now, isn't the county on the hook? In other words, if the corporation can't pay its bills, can't meet its obligation, the county has to pay
$300 million.
Okay, so the county has a financial stake in the success of this hospital.
Yeah, but you can't talk to anybody in the county about it because all the government officials just turn their back and say, go talk to Gianelli.
So what's happening at the hospital as they try to reduce their operating costs that affects your members?
Well, the only way that we thought that Art Gianelli, the current CEO, we were very much in favor of him when he came. Bright guy, thought out of the box, or at least we thought so, and he was analyzing things, he was finding new money. But then at the end of the day, he came back with the same answer that every other CEO
Which is
came
what?
With. Take it out of the employees. And, you know, in our last contract, we gave the healthcare corporation $30 million.
And give-backs.
And give-backs to help the
What were some of those things that you did in the last contract?
The first 5 hours of overtime that anybody works there is at straight time every week. That
Really?
gets used every week.
That's a significant. That's a significant give back. Yeah.
Significant, and
How
new
can you
hires
do
paid
that?
for their health
How
insurance.
could you do that with federal labor law?
You stay within the FLSA because they work 35-hour work weeks, so between 35
okay.
and 40.
So after, over 40. All right, but still, so you in effect going straight time for the 5 years to 40. For 35
Exactly.
to
So
40.
I mean, we did our share, and of course, we're willing to talk about doing a little more. But that's not what this current administration wants. They want us to basically, he was quoted in Newsday, throw the contract out the window, was his exact words. And I think a doctor should be running that hospital. I think Gianelli is a very bright guy. He'd be an excellent CFO. I don't know about administrating the whole hospital.
Well, now let's talk about the satellite health clinics that the county hospital also operates. Doctor, you're familiar with how they operate. You're part of this coalition, the Coalition for Community Wellbeing.
Yes, ma'am.
And you're actually providing free care yourself because
Yes.
those clinics are so overwhelmed.
Yes.
With people that they can't get in there when they're really sick.
And some people are afraid because of their cultural and history of of fear.
What, that they're undocumented? They're
part of it undocumented.
Or illegal aliens, whatever you want to call them.
Illegal aliens, also part of the fear of the system. You know, that they might get into the system, A, not be treated properly, and or reported.
So
you
how
have
does
that fear.
your clinic operate?
Well, my clinic was founded in 1994 by myself. At that time, we had...
It's where?
It's in Hempstead, 230 Hilton Avenue in Hempstead, Suite 217. At that time, we had about 30 million uninsured residents. But more importantly, when you look at the Nassau County Health Assessment Journal, what you found was that in Nassau County particularly, you will find that there were there are several communities, especially like Uniondale, Hempstead, Roosevelt, that are mostly minority and tremendously medically underserved.
High-need communities that have an extraordinary number
that
of
weren't
people who are
being served
uninsured.
by the medical center and or the clinic. So I got together with a couple of doctors that I know, and we started the first of our 3 concepts. And the first concept was the health evaluation program. And what we did with that is we have 6 health evaluation days, programs, that we take into each of these communities 6 times per year. And we have as many doctors as we can find, and we provide, the total care for these residents.
So you're doing in effect a physical to
everything,
determine any
EKGs,
problems.
blood work.
That is an extraordinary
For
service.
free, Doc.
For free.
For free. And when we can get the mammogram van, that's also there.
Yes.
And the second concept that we developed was the community wellness concept. In 1997, we were fortunate to get the community wellness center. And at that time, we started the program. We realized a couple of things in our experiences, is that many of these residents, healthcare culture is not part of their vocabulary.
Right.
Their culture is about survival.
People are coming from Central America, they're coming from South America. I mean, they don't see a doctor unless they are very ill.
Right, and in their countries they never did.
Right.
And here, the main thing is survival. So healthcare is low on the totem pole. So we were able now to try to educate them, and I myself, coming from South America, understands this culture very well. So we're able to adjust their diets.
So you're able to provide outreach
Right.
and communication
Right.
to people who don't typically access the county facilities.
Right.
What are the lessons here that the county needs to learn, and how can they build upon the resources that you've created, like through the Coalition for Community Wellbeing and the other work that you're doing?
Well, one of the ways they can build is that the third concept we worked on was the concept of a community hospital. Because we know, we understand something. In these special need communities, you have to have a special type of relationship and a special facility.
But Jerry, isn't that what the Nassau County Medical Center should be doing? It's a huge facility. Some people say parts of it are underutilized. Why can't they do a better job of providing the kind of outreach that the doctor is talking about and linking it? I'm saying, and partnering with this. I mean, we don't have to reinvent the wheel here. We have the assets.
No, and that's what we were hoping. By opening, like the old Hempstead General Hospital that was closed, we were hoping that by opening that facility, we can now partner with the medical center, as we're doing right now with St. Francis Hospital.
But doctor, aren't people saying that we have overbuilt the hospitals, we have too many beds? Now, we don't have too many beds for the poor and uninsured.
Exactly.
But we have too many beds for all the rest of us who are fortunate enough to have insurance.
If you drew an area map, you would see that the area that Dr. Lewis serves, the Roosevelt, Hempstead, Uniondale area, is underserved. But there are other areas where they overlap, the circles overlap. So basically what Dr. Lewis does, anybody with insurance, without insurance, he sees everybody and doesn't charge them a dime.
Now, doctor, what are you doing with St. Francis that's so unique?
That's
now, St. Francis is one of the best cardiac hospitals in the world.
Dr. Alan Gershie and his staff have been wonderful for the past 10 years with us. What they do is that they provide free cardiac care. All of our patients who come in, and many of them, because of high blood pressure and diabetes, have heart disease.
And that's related to lack of access to medication and diet.
That's the basic problem. And so his facility has been kind enough to provide free cardiac care. Anything that these patients need, Dr. Gershie and the St. Francis family have been kind enough to provide that care. And we were hoping, Pat, that same kind of relationship can be worked out with Nassau County Medical Center, but so far we've had a hard time getting that kind of relationship.
Look, you deal with these kinds of issues all the time. Your primary focus is to advocate for the employees, but the fact of the matter is that your employees have a public mission. And one of the most important things that the county does is to provide health care to its residents and to protect the public health. Because when you do the kinds of screenings, doctor, that you're talking about, you're not only helping the individual by identifying particular problems that they have, you're also identifying people who may have communicable diseases, that may have, where people are concerned about viruses and the flu and all that. You're able to provide that type of care and diagnosis before they might affect other people.
But think of what happens, Pat, is that prevention is the key here.
Exactly.
Okay? And look at the money you save by preventing something as opposed to the end stage treatment when the kidneys are gone, the diabetes, the heart is gone. I mean, a bypass costs you at least $200,000.
So Jerry, what are the lessons that the county should learn here? I mean, President Obama right now has said that in the next 8 weeks, in fact, he was just out in Wisconsin talking about health care. Congress has got to provide a health care plan that will cover everybody. But he also says we have to do exactly what Dr. Aubrey is talking about, which is to make sure that we deal with prevention. What can your members in the county do in that respect?
Well, I think the first thing we need to do is stop ignoring the problem, make them believe it's going to go away, because it's not. It's only increasing. There's a whole age group. Most children or kids that hit 19, 20 years old, if they don't have a job, they fall off their parents' insurance. This is a national crisis. You don't find too many doctors like Dr. Lewis that's willing to put their own time into something like this. We wanted to see the Healthcare Corporation, the Nassau Healthcare Corporation, reach out to this community through Dr. Lewis, and they would have an entire neighborhood. You talk about increasing the count there, the beds filled. I think the way to do that is to reach out to these communities and bring these patients in. We don't do that.
And leverage those community resources, as Dr. Lewis was saying. The key is detection, prevention, and then accessing the services that are already there. Dr. Aubrey Lewis, I want to thank you very much.
So much.
Keep up the fight. This is important work.
Thank you.
And Jerry, thank you so much for being
Always
here again.
a pleasure.
I want to thank CSEA President Jerry Laricchinta and Dr. Aubrey Lewis for being here today. And don't forget, you can catch Meet the Leaders on demand. Just go to channel 502. Select news and local news and world, that is, local on demand, and choose Long Island. Thanks for watching Cablevision's Meet the Leaders. I'm Pat Halpin. We'll see you next time.
Our veterans and their families need your help. That's why VetsHelp.org was created. One of VetsHelp's primary goals is facilitating the consolidation of medical research being conducted by independent laboratories all around the country. These research facilities will be funded to work together in helping to find ways to help the veterans and their families. For more information how you can help VetsHelp.org, please go to their website at www.vets-help.org.
Breast cancer is in my DNA.
Autism is in my DNA.
Ovarian cancer is in my DNA.
For over 100 years, scientists at Cold Spring Harbor Laboratory have been leaders in finding the underlying genetic causes behind cancer and neurological disorders such as autism, Parkinson's, Alzheimer's, and schizophrenia. Cold Spring Harbor Laboratory, from DNA to discovery.